Good day, everyone. Our topic today is visual diagnosis, ears 2. Large ear. The ear should be proportionate to the size of the head. Therefore, what is large ear for one person might be normal for another. A large ear generally indicates a good hereditary constitution, a constitutional tendency to abundance of qi and blood, and a propensity to full condition. However, it does so only if it is proportionate to the size of the head, well shaped, and does not stick out, and if the lobe is long and well formed. Okay, let's see the pictures. This one, small ears. Small ears generally indicate poor hereditary constitution, especially if the lobe is very small. A constitutional tendency to deficiency of blood or of qi and blood, and propensity to deficiency condition. Swollen ears. Swollen ears are generally due to heat or damp heat, which may derive from various organs, but particularly from the gallbladder. Another possible cause of swollen ears is invasion of wind water in the lungs. This one is a swollen ear, also red inlet. Okay. Letter A, damp heat in the gallbladder. Swollen and red ears, earache, ear discharge, a sticky taste, hypochondrial pain, coolness and distension, nausea, vomiting, inability to digest spots, yellow complexion and eyes, dizziness, tinnitus, irritability, feeling of heaviness, unilateral or bilateral, thick, sticky yellow coating in the tongue. Okay, and the pulse is slippery, rapid. Okay, let's talk about heat in the gallbladder, letter B. Swollen and red ears, earache, thirst, bitter taste, irritability, headache, unilateral yellow tongue coating again. And the pulse is wiry, rapid. Okay, letter C. Invasion of wind water in the lungs. Okay, swollen ears with acute onset, edema of the face and hands, aversion to cold, fever, headache, and the tongue is white tongue coating, and the pulse is floating slippery. Contracted ears. Contracted ears look somewhat crumpled and squashed. Contracted ears are generally due to deficiency of body fluid, which may derive either from heat injuring the body fluids or from yin deficiency. A less common cause of contracted ears is a severe stasis of blood in the abdomen with abdominal masses. The severely stagnant qi and blood fail to nourish the muscle and flesh, so that the person loses weight and the ears become contracted. This situation could occur, for example, with carcinomas of the abdomen. Okay, as you can see in the picture. Okay, letter A, kidney yin deficiency. Contracted and dry ears, dizziness, tinnitus, night sweating, dry mouth with desire to drink in small sips, backache, poor memory, dark scanty urine, and the tongue is without coating, and the pulse is floating empty. Okay, letter B, aftermath of acute heat and febrile disease. Contracted, dry ears, dry mouth, exhaustion, dry skin, dry tongue, and the pulse is fine. Letter C, severe blood stasis in the abdomen with abdominal masses. Contracted, dry, dull, and dark ears, dry mouth, dry skin, abdominal pain, loss of weight, and the tongue is purple, and the pulse is wiry or choppy. Dry and contracted helix. The most common cause of contracted dry helix with the rough and scaly texture is blood stasis, sometimes combined with damp heat. A dry and dark helix may also be due to kidney deficiency. A jag helix indicates chronic blood stasis, as you can see in the picture. Okay? Letter A, blood stasis, dry, contracted, and dark helix. Abdominal pain, chest pain, purple tongue, wiry or choppy pulse. Other symptoms and signs depend on organs involved, which may be liver, heart, stomach, or intestine. Letter B, blood stasis with damp heat, dry and contracted helix. Abdominal pain, mucus in the stools, loose stools, purple tongue with sticky yellow coating, and the pulse is wiry and slippery. Letter C, kidney deficiency. Dry, dark, and contracted helix, tinnitus, dizziness, night sweating, dry mouth with desire to sip water, backache, poor memory, dark scanty urine, and the tongue is without coating, and the pulse is floating empty. Sores on the ear. Okay, as you can see in the picture, sores on the ear are always due to heat. They may derive from various organs but are particularly related to the liver and gallbladder. Another cause of acute sores on the ear is invasion of wind heat in the lesser yang channel, Sanjiao and gallbladder. Okay. Letter A, heat in the gallbladder and liver. Sores on the ear, red face, headache, irritability, bitter taste, dizziness, hypochondrial pain, red tongue with yellow coating, and the pulse is wiry, rapid. Okay, letter B, invasion of wind heat in the lesser yang channel. Sores on the earache, alternating chills and fever, irritability, headache, tongue with red sides, and possibility of unilateral white coating. Possibly unilateral white coating, and the pulse is floating, rapid, and wiry. You can see in the picture, warts on the ear are generally due to heat in the liver and gallbladder, but they may also be due to heat in the stomach channel as deep pathways of the stomach channels goes to the ear. Letter A, heat in the gallbladder and liver. Warts on the ear, red face, headache, irritability, dizziness, bitter taste, hypochondrial pain, red tongue with yellow coating. And the pulse is wiry, rapid. Letter B, stomach fire. Warts on the ear, burning gastric pain, intense thirst with desire to drink cold liquid, mental restlessness, bleeding gums, dry stools, regurgitation, foul breath, feeling of heat. The tongue is red with a thick, dry, dark yellow coating. And the pulse is deep, full, rapid. Yellow helix. Okay, as you can see in the picture, damp heat is the most common cause of a yellow helix. It would be bright yellow if heat predominates and dull yellow yellow if dampness predominates. Another possible cause of a yellow helix is blood stasis deriving from heat, in which case the helix will be dull, dark yellow. A. Letter A, damp heat in the gallbladder. Yellow, bitter and sticky taste. Here A, nausea, vomiting. Yellow, letter B, blood stasis deriving from heat, liver and gallbladder. Dull, dark yellow helix, earache, hypochondrial pain, thirst, dry mouth, headache, irritability, reddish purple tongue with unilateral yellow coating. And the pulse is wiry, rapid. Okay, next. Pale helix. A pale helix is due either to yang deficiency, bright pale, or to blood deficiency, dull pale. A less common cause of a pale helix is invasion of wind water in the lung. A thick, deep white color indicates T deficiency with phlegm. Okay. Yang deficiency, letter A. Pale helix, feeling cold, tiredness, cold limbs, loose stools, pale and wet tongue, deep, weak ang pulse, the pulse. Other symptoms and signs depend on organ fault. It's yang deficiency. Letter B, blood deficiency. Pale, dry helix, dry skin, blurred vision, dizziness, numbness of the limbs, scanty periods, pale tongue, and the pulse is choppy or fine. Bluish greenish helix. Blood stasis is the main cause of bluish greenish helix. The helix is greenish if the blood stasis derives from heat and bluish if it derives from cold. A particular case of bluish-greenish helix is that seen in children suffering from acute convulsion from internal bleed. Letter A, blood stasis from heat. Greenish, dry helix, abdominal pain, chest pain, reddish and purple tongue with the pulse of wiry or choppy, and the other symptoms and signs is, depend on organ involved. Okay, letter B, blood stasis from cold. Bluish, wet helix, abdominal pain, chest pain, bluish purple tongue with wiry or choppy pulse, and other symptoms and signs depend on organ involved. Internal wind in children. Letter C, greenish, helix, tremor, convulsion, fever, epistonos, stiff tongue, and is wiry. Dark helix. Dark helix may become dark either from blood stasis or from chronic heat. A greenish dark helix indicates kidney yin deficiency, as you can see in the picture. Okay. Letter A, blood stasis, dark and dry helix, dry mouth, dark complexion, dry skin, abdominal pain, chest pain, purple tongue, and with wiry or choppy pulse. Letter B, blood stasis from cold, dark, moist helix, abdominal pain, chest pain, bluish and purple tongue also. And the pulse is wiry or choppy. Letter C, chronic heat, dark and dry helix, red face, thirst, dry skin, dry mouth, dry stools, dry red tongue with yellow coating, the tongue, and overflowing rapid pulse. Other symptoms and signs depend on other organs. Okay, thank you for your attention, everyone. Have a good day.